Hi, my name is Yash. As an aspiring doctor, I've often found myself at crossroads contemplating the question of whether medicine truly achieves its purpose. I often hear that the goal of medicine is to heal the sick, and although I truly respect the intentions behind this lofty sentiment, with our growing Asian population in the developed world, we must begin to accept that achieving this goal will become increasingly difficult. That's why I will be discussing my thoughts on a video titled Should Doctors Help People End Their Lives by Rohin Francis, an interventional cardiologist in the UK and creator of the channel Medlife Crisis. I will begin by discussing some of the moral quandaries associated with rejecting assisting dying that Dr. Francis raises, and then I'll provide my opinion for how medicine should progress based on my understanding of the video. Dr. Francis discusses the challenging journey of his mother, who died from progressive cerebral palsy, an incurable illness. He recounted his mother had no fear of death itself, as she had achieved everything that she wanted to in life, but rather, she had a fear of suffering. Most of us hope to die of old age in our sleep with no debilitating illnesses. However, those with terminal illness are not afforded this luxury. Patients with late-stage cancer, multiple organ failure, or motor neuron disease must continue living for months, or even years, with the knowledge that the rest of their life will be plagued with suffering. Rohin encourages us to imagine ourselves in this position where every living moment results in net suffering, and personally, I found this hypothetical to be a grim reality. Dr. Francis discusses that for most people in the world, assisted dying legislation is not available, and as such, they are left with two options: either pursue expensive assisted dying programs in countries like Switzerland, or take their own life in an uncontrolled and painful manner. Now, this is not a hypothetical. Royan highlights one case out of many thousands where a husband found his wife dead in bed after she suffocated herself with a plastic bag so that she wouldn't be a burden to her family due to terminal illness. This visceral example provided in the video made me consciously realize that absolutely no one should have to suffer by themselves in the final moments of their life, and I appreciate Dr. Francis' solution: access to legal assisted dying. Opponents of assisted dying often claim that for a doctor to administer a lethal injection to speed up death would be tantamount to crossing a line. But why is this? Why are we so afraid of death? Why are we not more afraid of suffering? Personally, I tend to agree with Dr. Francis that medicine should adopt a more utilitarian approach towards assisted dying. The mantra of doing no harm must be replaced by seeking to minimize suffering and maximizing pleasure. Our goal in medicine is to heal the sick, but when this is not possible, our imperative must be to reduce suffering. Dr. Francis eloquently highlights that suffering should no longer be viewed as an inevitability of life, and I hope in the future it is something that everyone has an autonomous control over.